Hello, everybody. Welcome to this Implementation Science School lecture, Module 2, Lecture 2B. My name is Ruth Verhey. I'm based in Zimbabwe. I'm a clinical psychologist and global mental health researcher. I want to talk to you about community participatory action research today. If I can get to move the slides. Here we go. In this lecture, we talk about what is community action participatory research and what are challenges of it to research in communities. What is the historical aspect of it? What are the principles? I want to show some applied examples and the learnings that I personally had, and we'll talk about some key messages. Challenges in relationships between academics and community are vast. And basically the question is who brings what to the table? So when we talk about implementers, we mean the activists, the change makers. These people are holding systemic knowledge. But how much are they uniformly representing a community, which already leads us to this place? How are we getting actually everybody's voice to the table? The researchers on their side make a commitment to doing the research. They are supposed to be self-conscious actors and participants in the development. And can they understand that they are inherently holding power, whether that's money or knowledge in form of education, being different, coming from outside. So I found this little quote from the 1980s, and basically, you don't have to read it all, but basically it means we have to be so careful when we do community research so it does not become some romantic passage for a researcher's future book, which leaves the oppressed in much the same state of affairs. So you already get the idea of what we're talking about here. Community participatory action research is an innovative research paradigm, and we want to combine knowledge and action to improve community health and obviously reduce health disparity. So we want to increase health equity. And therefore we want to involve community members, right? We cannot come somewhere and pretend we have the solutions to problems that we haven't even identified because we don't live them. We don't live in this community, right? So the interesting thing here is how can we elicit the diverse contributions from the community to understand? And obviously it is with, for, and in the communities. The history of it dates back to like the 1970s and probably much earlier, and comes from social research and social justice movements. And it was literally that idea that I mentioned earlier. We want to fight against a oppressor coming in, researching the oppressed, and then walking off. Also, we all know that the gap between putting results of research into action is way too vast. So this is an approach to make it faster. The principles of inclusion, diversity, and equity are extremely important in this context. Although we must say all that idea of being objective and value neutral when coming in is questionable. So we want to be aware of these things. So, principles of community participatory action research. Our idea is we want to improve health equity. So, a community-driven, patient-centered healthcare should leave us with healthy individuals, right? We want to be problem-oriented in order to find the right solutions to the problems that have been identified. And we need to figure out what conditions actually influence the maintenance of the problems. And we want to base everything on equitable collaboration, which means we're doing a bottom-up approach, which is not always what happens in academia. So first of all, we have to figure out who is the community, or who is in the community. We need to develop a relationship, and we need to recognize the mutual interest that there is. That means we have to give a voice to everyone, right? Who are we actually inviting to collaborate, and who is inviting the people to collaborate? We have to experience the community, learn the language. And I don't mean that only literally. It would be great to learn the language, but to learn the nuances in a specific community. This might mean staying there for quite a long time. We have to ask for trust. And we all know that probably many communities have seen researchers come in and leave again without any impact or not felt impact, or NGOs coming in with programs. And once the NGOs maybe lost their funding and left, the programs fall apart. So there might be initial distrust. When I say hear the community's voice here, I not so much mean give them a voice, but rather actually understand they are voices and we need to hear them. So you all know about tools to involve members like stakeholder mapping, advisory boards, theory of change workshops, focus group discussions, surveys, all of those. And the interesting bit here is how are they conducted? How are they laid out? How are they planned? Is the community, for instance, already involved in creating these workshops and the way they are done? And ideally, of course, a community approaches a research team. I don't think that happens so often, and we definitely have to create more awareness and obviously capacity building to empower communities to be able to do exactly this. So then ideally, they formulate the research questions together and also develop the grant together, which also means that we need funders to consider creating grants for development, even if maybe nothing comes out of it, right? So the community involvement is absolutely crucial for everything. And this is why we're here talking about implementation science, because this is exactly down our aisle. We want to understand how to implement programs in communities so that they actually work long term. And obviously, the more the involvement, the stronger the implementation will be. The inclusivity of, for instance, advisory board memberships are a big topic. We would probably intuitively go to those who are community leaders, who are gatekeepers. But what does that mean for inclusivity? What about those now not recognized future leaders, young people, minority representatives? All of those people would have to be involved to have inclusivity. How do we do that, though, if, for instance, cultural rules would prohibit this? Are we allowed to break those rules? What would happen to the community? What would happen to those minority members that we now talk to and invite in? So these are all kind of things to think about that are not easy to solve. And by no means do I say I have the solution here. I just want us to start thinking about those complex aspects of it. Obviously, we want to have the involvement cyclical and iterative, and we want to have mutual decisions on who does what, and who's involved how, and who gets rewarded how. When it comes to the future programs, the products, the results of our research, we need to check for accessibility and usefulness, of course, and who can evaluate those. Again, it should be inclusive, it should be very diverse, and we all have to look at these aspects of what is our gaze, who's involved in evaluating impact, what is the positionality, what's the cultural understanding that we hold, what funding requirements do we have, and what are political reasons for a product to be implemented or not. So when we talk about results that we obviously want to get from our research, we need to disseminate in all directions. So we need to aim at all different learners. We know that, like, we can't just publish in scientific journals and then be astonished that nobody has heard about it, right? So we obviously have now social media and like all sorts of amazing things that can help reach everybody, literally. We definitely need to take the results back to the community, and they will know who needs to learn, and we want to help the community. And this is actually often happening, that a successful research community collaboration then has the power to help the community to reach out to policymakers, for instance, which is important. Can we allow for co-authoring? This is the one with like reaching out to policymakers to actually get change. And can we bring community members to conferences, for instance, to themselves, report on what happened during the research program? Here we go. So the continued collaboration is something that I keep repeating on. This is what needs to happen. We need to build relationships that are long lasting and which might definitely go over and beyond any kind of grant period that was accounted for. So what could this continued collaboration look like? What does it take to have sustainability? In the end, of course, what voltage drop in our program is even acceptable? When are we stepping out and saying, this doesn't work? It worked during our programming, during the research period, but now it doesn't. What are the limitations of collaboration? Think resources and time, money, all of those things. And literally, where do the resources come from? Maybe take a moment, maybe stop this video for a moment and just think about, how would you answer these questions? While you maybe look at the beautiful Victoria Falls here in Zimbabwe. So when I go back, and I hope you had some thinking time, when I go back to this long-standing engagement, keep showing up and build social networks that are long-lasting, connect people with other people. So we are creating this movement of change that feels safe and trustworthy. What I find extremely important is that we all need to allow respect and recognition for frustration, because people will be frustrated. Someone will be frustrated. And are we able to create a forum for that to hear? Because that will, as we said, iterative, bring back important information back to us. Okay, so a bit of a critical appraisal of the participatory action research is it less scientific? Is it like a little bit too, not giving us the right data or something? And I think that's where it's so good if we can link it up with the implementation research and plan that out and map that out really, really, really well. And you're all interested in this and you're all learning about it. So that's wonderful. The second question, which is like an inherent criticism to it, is it really participatory? Is there really equality? Can there be really equality? Someone will always have to start it. And who is this someone? Is this someone, someone who has the skills, the idea, the time, the resources? So that person in a way comes in with power. And I'm not saying this is bad or good or whatever. It's just that someone will have to start it. Researchers often act as guides and consultants. And if you remember back, that's why it's important that there are self-conscious about their role when they go into a community and leave the community again. Where does the funding come from? Always, and who accounts for it is just important. I want to just tell you a little bit about my experiences. So I have helped to set up the Friendship Bench, which I've been part of for many, many years in a community approach in Ohio. And I've been working with the Department for Community of Health. We adapted the training material. We did participatory means such as theory of change workshops with people. We did a training in May 2022. And since then, I've been in touch with them and practiced with them and support them in regular calls. And just the other day, we thought, my counterparts in Ohio said that they felt these like 2.5 years of ongoing support has helped them to pull through a lot of obstacles. It's a super small implementation, but it's kind of like grown steadily and has gained a lot of interest. They're now offering their own trainings to people, and they're being asked by other states around them for advice, for support, for maybe helping them to set up similar projects. The learnings there was this: they had funding, they have continued funding, they got more, they're very established, they know how to get funding. We have this ongoing collaboration, like I said, and it's not so much focused on science as such, but as in offering a support for people in need, which is being received well in their community. Then I worked with the group in Ontario, London, Ontario, in Canada, and it was to help racialized minorities there to receive support, similar Friendship Bench approach by peers. And the very enthusiastic and idealistic people there did an immense effort to create community awareness. It was really amazing. We did lots of theory of change workshops with different groups, and we ended up doing a training as well. And then we had to learn, if there's not enough funding, it is collapsing very, very fast. Yeah, you might think, yeah, that's logic, but yes, we had to learn it the hard way, kind of thing. And if there's lack of funding, then also often it influences the level of coordination that is happening. And in this case, we also couldn't quite coordinate the different services that were available to link up one big movement. I think it was also part of the very diverse community. So we're still in touch with them, but we're trying to explore how else this could be done. Then I worked in Colombia with an amazing group of people, again, like you, people who have vision, who have ideas, who want to help, who want to increase equity to mental health and services. And so I worked with a group of Colombian medical professionals to translate material. There was a vast interest in the community who is very underprivileged in terms of access to mental health care. Again, we did the whole community participatory approaches that were able. People were very vocal, and we worked on starting up slowly but surely a service. Small, we continue to collaborate. We are fighting for more funding, and there's a research component as well. So this is working. Our learnings are we need a specialist in this to create funding opportunities and find those. Again, here we were working with volunteers, very, very engaged people in communities, but it poses this question: is that okay to rely on volunteerism, for instance? We definitely need to constantly work on the evaluation of the program and the capacity building, and we want to keep creating like that community connection between community and academia in this case. Now, another program I'm working with, again in London, Ontario, interestingly enough, with Francophone minorities. So I'm working with the Canadian Mental Health Organization there, and we are creating a program focusing on loneliness and connection, social connection for them. And Francophone minorities have a right to access to services in French in Canada, and there is just not enough possibility to offer that. So we're working with the peer approach with existing Francophone organizations there. Again, working with a powerhouse like the Canadian Mental Health Association makes a difference. They're established, they've got connections, they've got services running, and bringing in community members is what we did. Basically, now we received funding and we're going to go ahead and implement the program. The learnings here as well is we need to interact as early as possible with the community members to hear what they have to say, what they want. The context is the massive diversity of newcomers to that community or to Canada in general, and to obviously celebrate that they hold the cultural and the linguistic and the experiential understanding of what they need and what they want and what would help them. So another project I'm involved with is Heal Together. That's again a collaboration between academia and community organization that is quite established for Black women specifically. It's called Sister Afia. And we did a training to a first group who were a lot of mental health professionals of some sort, interesting enough. And we're using this group now as the advisory board. We did a lot of community consultations here as well to understand what is needed, how is it needed. We ran a little pilot study and are now, as we have more money, like working into in the implementation, basically with other organizations who, for instance, offer certain sides of the program. So there is, I was just told there's a housing company that builds flats and things and also offers services. So this is for underprivileged people living there. So this is a great community because it means also that there's no distance between service and where people live, which can be a problem, like to have transport. And our learnings here are, so a consultant, so that's in case it was me, brings a model, I bring a training, how do I need to adapt it? So I had to be very, very open to hearing what is possible, what's not possible. So we constantly focused on mutual learning and getting an adaptation. We're constantly still adapting it. And we understood as well, this is not just a skill and we're doing a skills-based training, we're actually building a community of practice here, which was very well received. And I just, when you see the little asterisks, the outcome of our theory of change workshop was, so the dream, the vision of the present people there was a collective community rooted in and transformed by joy and healing with equitable resources and restorative practice. And everybody felt that that statement that they formulated was holding so much power that it gave them so much motivation to keep going, despite not being paid for this, many of them. So again, we're looking at a mixture of having grant money to pay people, but also having volunteers who support this just with their dream to see change. So my key messages to you today are listen. I hope you also listen today. There are voices all over around you who've got something to say. Invite everybody to mutually learn. That means yourself as well. You're probably the biggest learner in all of this. One of our African proverbs says, if you want to walk fast, go alone. If you want to walk far, walk with others. And then last but not least, stay and keep listening. Thank you so much for listening to this. I wish you a wonderful implementation science school experience and all the best for you. Thank you.